Welcome back to Myeloma Matters, brought to you by the Multiple Myeloma Research Foundation. I'm your host, Veronica Borges-Med, Senior Manager of Community Engagement and Education. Today we're diving into part 2 of our discussion about the transition of care after CAR T-cell and bispecific antibody therapy. If you're just tuning in now, be sure to listen to part 1, where we explored why many myeloma treatments begin at specialized centers and how care is co-managed between those centers and local community teams. You can find part 1 on Spotify, the MMRF YouTube channel, or wherever you listen to your podcasts. In today's episode, we'll take a deeper dive into the logistics of this transition, covering everything from scheduling treatments around family and holiday plans, navigating decisions about inpatient versus outpatient care, managing travel and temporary housing, coordinating medical records, and securing financial support. Joining me today, I'm pleased to welcome Dr. Dower, a hematologist-oncologist from Stamford Health in Connecticut, as well as 2 patients, Annie and Kim, who will share their personal experiences and insights as they've navigated these logistical challenges. So let's get started. Let's pivot over now to how patients and caregivers navigate the logistics of transition of care, such as travel, scheduling, communicating between centers, and even financial issues. Annie, in our initial discussion with you, you'd shared a unique situation in terms of receiving CAR T-cell therapy and having to do a bit of research beforehand, which was having to navigate testing and logistics prior to receiving treatment at the specialized center, as it was about 3 hours away from your home. Can you tell us what you had to do and how you got through it? And you can share with us also how your caregiver was involved?
Sure. CAR T cell therapy, relatively new, so it was a little bit daunting to say, okay, this is what I'm going to do. And then you have to really sort of plan it out with your community doctor, your local institution, and your family. Just for instance, when I realized this was the treatment that I needed, it was in August or September of last year. And so then you have to have a whole calendar of the pre-treatment. When you're going to have the CAR T cells taken from you? What's the pre-treatment from that? How long you have to wait before they actually come back as superpowers that will be put back in you? And it was also the holidays. So it was Thanksgiving and Christmas. And so it took a while to figure out how the treatments would factor into our entire family and our schedule. And with some thought, some time, and a lot of phone calls, et cetera, we figured out the right time frame to start the treatment, the protocol, which took us through November, and then we got a break and said, okay, new year, new me. We'll do it in January, and so it took a while to figure out exactly how that all would work, but Dr. Dower and Dana Farber all worked together to find the right schedule for us and the right treatment. The other interesting choice I had was whether I would do inpatient or outpatient. And that was a little bit daunting, again, to figure out what was right for me and my family, knowing that the treatment was about 6 weeks long in where I'd have to stay in Boston. But honestly, it was only probably going to be about a week in the hospital. Again, these are just not given. So it's a little, like, will I be in the hospital for 2 weeks or will it be like 5 days? But I couldn't imagine feeling relatively well and being in a hospital for a month. So we chose as a family to do it outpatient. And that has its own issues and logistics. And luckily for me, it was certainly the right choice, but it was daunting. We had to rent an apartment, a mile away from the hospital. We have a dog, so the dog had to go and spend the month with my daughter. So things like that were definitely challenging, but doable. If you have the right care team, you ask the right questions, you advocate for yourself. Just ask a lot of questions, but it's challenging, but it all seems to have worked out. I will say that it was really helpful to talk to other patients, although I didn't know another patient who did the CAR T as an outpatient. So I know an experiences with the inpatient, and they're like, fine, I was fine for 3 weeks in the hospital. I'm like, not me. I wouldn't be able to be in a hospital room for, 3 weeks without moving. So I think it's really important to reach out, whether it's through the MMRF or through your own community doctor, to connect you with other patients who have had similar experiences. And I will say, I am happy to give my contact information to people who are listening if they want to hear what an outpatient experience is.
Thank you, Annie. Well, our listeners have heard it here first. So if they need to check in, that's great to hear. And great to hear, I think, especially a patient like yourself, making sure that your preferences are number one. And I think it's really great to hear that, because I'm sure some patients might get there's a lot of intimidation and overwhelm of information, and having to make the steps to maybe choose something that you didn't hear other patients really go through in terms of them being outpatient. That's really admirable to see on your end, but also a great example for our listeners to hear. So thanks for adding that. Very appreciated. Great. So Kim, we'll kick it now over to you. You've been on a bispecific antibody treatment. Can you tell us about any logistical issues you've had to manage between the specialized center and your local clinic?
First, I want to let people know there are foundations like Leukemia Lymphoma Society, which is Blood Cancer United. There is Copay Relief Program. There is Healthwell Foundation. All of these foundations offer grants for copay premiums, for help with logistics, for help with paying your electricity. A lot of people don't have the financial capability to, quit work or leave work for 2 or 3 weeks at a time to go to these, academic centers, or for stem cells or CAR T cells or biospecifics. And there is help out there. I just wanted to throw that out there because that is huge. Second thing is, when I was first diagnosed, the first person or place I contacted was Leukemia Lymphoma Society. They got me in contact with someone who is a peer monitor, who called me and they said, "Hey, are you willing to talk to someone just diagnosed? She doesn't want to Google. Life expectancy, she knows, is 3 to 5 years, blah, 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 blah." And I got in contact with a peer mentor who has multiple myeloma. That was huge in everything, whether it was being inpatient, outpatient for stem cell. Multiple myeloma research fund was huge. Support services are huge. Online support meetings are where I get a lot of my information, a lot of feedback between patients. As for me, I was lucky. My husband works from home. We were able to go to Levine, do the 10-day step up with the biospecific, and then I came home. In regards to stem cell transplants, I had both of mine inpatient. The first time there was not an option to do it outpatient. The second time here in North Carolina, I opted to do inpatient just because I knew how sick I was going to be, and being outpatient was completely out of the question. I wanted to be in the hospital where I knew if I needed someone, it was going to be there immediately. My husband could come and go, take a few days off, come back, and he knew that I was being well taken care of. So that's just a preference, whether you want to do inpatient or outpatient. It's a very personal decision based on your circumstances, and there's no right or wrong answer to it. Just like Annie, she wanted to do outpatient. I was like, oh, no, 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 no. I want to be in the hospital. I want to stay put. Just because I knew what my side effects were going to be with the transplant, and I could not even fathom feeling as horrible as I did being an outpatient. That just wasn't even an option for me. So I knew going into the biospecific, where you're in a hospital for a day, then you're out for 2 days, and then you're back in to do the other step up. I was at like what they call like the Hope Lodge down in Charlotte, which is literally like a Ronald McDonald House. And so my husband and I would stay there and go back and forth. They had shuttles, and it was very easy to navigate the whole process thanks to my care teams in both places.
Dr. Dower, what advice do you give patients, as we heard from both Kim and Annie right now, how they approach this? What is your advice to patients when they're about to have to make these similar decisions?
I always tell everybody to really look towards everybody in your care team. And it's not just the physician. The nurse navigators can really move mountains for patients. And I look to them all the time to help so much with a lot of these logistical challenges, and thinking about, what the experience is going to look like in the next several weeks, months, etc. And the nurse navigators, the nurses, the social workers, they're all there to help patients really figure out exactly what that experience is going to look like and talk through some of these logistical challenges, the financial part of this, the time, the materials that you would need to get time off from work, and getting financial assistance from different local and national philanthropic organizations. It's really invaluable to utilize a lot of these support systems that we have available both at your local community center and at the academic center, where you're going to be getting some of these treatments to make sure that you're succeeding through this whole experience. I'm not here to try to make this something that's going to be overly impactful in terms of somebody's life. I know that that's not to be said lightly. Everything we do has serious things to be considered when we're thinking about starting new treatments, and it's important to utilize all of these resources. I also think that the support groups, both locally and nationally, can be really helpful to patients. It's really important to hear what a patient experience is like. It's one thing to hear it from your doctor, but it's another thing to hear it from other patients who have gone through the similar experience, because that really can give a great perspective in terms of what the next couple of weeks or months is going to look like. So I think utilizing all those resources available to you will be really helpful as you kind of navigate the next steps.
Well, now as we're at kind of the final piece of our podcast, I have a final question for all of you. How can patients and caregivers advocate for themselves? And that is asking the right questions, leaning on their care team, seeking resources to ensure they're receiving the best possible care during their transition of care when on a CAR T cell or bispecific antibody therapy. Annie, you can start.
I would say my first piece of advice, probably like Kim's, particularly to my family when I was first diagnosed, I said, get off the internet, don't look at anything, and go to MMRF website, go to Dana-Farber's website, go to Stamford Community Health Partnership website. Those three. Don't don't search the internet. Don't do any of that. The institutions and the foundation have great resources, and that was really key. And then moving forward, and as you know, Dr. Dower, all the treatments have changed in the past 10 years. And so again, when this decision to do CAR T cell therapy, when to do it and what it looked like, and really understanding the entire year of what that was going to be, my husband actually went on both MMRF and Dana-Farber and took some webinars to really kind of understand what logistically things were going to look like, so he could actually sort of picture what it was going to look like for our family. So it wasn't as daunting to him. And then I agree with Dr. Dower too. The institutions, the nurse navigators, the social workers are really key to feeling comfortable with your therapies.
Thank you. Kim?
Gosh, I think the first thing that was huge for me was talking to a peer mentor, was talking to someone who actually had myeloma. When you first get diagnosed with multiple myeloma, I mean, it looks like it's your deathbed. I mean, my son was 2.5. I thought I would not see him go to kindergarten. So I immediately got off of the internet, talked to a peer tutor, and then that really calmed my nerves. That person was able to get me in touch and told me about the MMRF, the International Myeloma Foundation, Leukemia Lymphoma Society, all of the different support that's out there, and as well as finding a local support group. That was the biggest help to my husband and I, was finding people who we sat across from at a table locally in St. Louis, had coffee, had donuts, and were actually to talk as long as we wanted with as many questions, because there were so many people were so many different parts of their treatment, different treatments. That to me was the best gift that anyone could give me, was getting into a support group. That was huge for me. And then of course, then my local oncologist and my support team at the academic place, the nurse navigator and the social workers, they take so much worry. They handle it all. They can handle it all. If you just says, I can't do this, send me the piece of paper, I'll sign it. But I did not want to go back and forth with all these different foundations to find help with logistics and all this. They handled it. And that was huge. That was huge.
I agree. I think talking to people face to face. I unfortunately live in an area where there are many multiple myeloma patients. So I actually knew two people who had it at the time. And that was also huge. Yes, sitting, having coffee with them, hearing their experiences is really very, very important.
Thank you, Kim and Annie. Dr. Dower, you have the last word.
Yeah, what I would say is never be afraid to ask lots and lots of questions. It's really important to remember that multiple myeloma is a really long-term and lifelong experience. And, when you're kind of facing this, there are so many things that are going to come up that are confusing, and the disease itself can be a little bit abstract to really understand exactly what is going on and why do you have to go through all these therapies. And I think asking lots of questions of your care team, so your physicians, your nurses, the social workers of other patients and people going through similar things, by accessing them through support groups and other resources, is really important, so that you really feel comfortable about what is this disorder, what is the status of your disorder, what is the experience going to be like with these treatments, and how is it going. I think that's really, really important, always at every step of this experience, to ask lots of questions. And also, it's just important to remember, I think Annie and Kim really did nail this one. You really can't think about, if everything you read online and everything that can be said about multiple myeloma, because this disease is changing so fast. There is no field in hematology or medicine in general that I can think of that is changing so quickly for the better, like multiple myeloma. It's an unbelievable change of events in the last 5, 10, and 15 years, and all to better serve patients. As someone who thinks about this disease every single day, it really is exciting for me to learn about all the new opportunities and new treatment options that we can offer to patients that help them continue to live well with this disease and for a long period of time. And that's what I try to remind all of my patients throughout their experience, whether it's at the beginning or the middle or wherever they are in their journey, that it really is an exciting time to be in this field, and it's all for the better of patients. So we're here to serve you, and you should always ask us questions, send us messages through the portal, or you could just call the nurse navigator if you don't have one of those, the electronic medical record system. And there's lots of ways to ask questions and make sure you get them answered. And we're here to help.
Dr. Dower, Kim, and Annie, it's been a pleasure talking with you today. Thank you all for sharing your experiences. Thank you for listening to this episode of Myeloma Matters on the transition of care from a specialty center to a community practice, hosted by the Multiple Myeloma Research Foundation. The MMRF thanks Dr. Dower, Annie, and Kim for sharing their unique perspective and insights. The MMRF also thanks Pfizer for their generous support of this podcast. The information in this podcast is not intended to replace the services or advice of trained healthcare professionals. If you have questions about what you heard today, please call the MMRF Patient Navigation Center at 1-888-841-6673. If you've enjoyed this series, be sure to leave a comment or review wherever you get your podcasts. This is Veronica Borges-Med from the Multiple Myeloma Research Foundation, wishing you strength and hope. Until next time.